Hey guys, it's Dr. Chris. I want to give you a demonstration today on how to use the Theragun dealing with shoulders. When we deal with throwers, in particularly with shoulders, the main areas we want to take a look at that frequently go undetected because the pain isn't necessarily where we're going to work. A lot of times the pain with throwers is going to be up in the front, which has nothing to do with the front part of the shoulder. It has to do with the scapula not being able to move freely, which then restricts the humerus head inside the glenoid, inside the shoulder joint and that ball and socket joint. When that can't move freely, then it puts a lot of abnormal strain on the bicep tendon and the deltoids, and that's where most of the pain shows up. That's what the athlete will experience and complain about, when in reality it's the muscles that control the scapula that have gotten overly tight and not allowed for free movement. So we're talking about the teres minor, teres major to some degree. We're talking about the subscapularis muscle, and then of course the rhomboid muscles. So the way that we're going to attack that is we're going to use the Theragun on a general sort of a sweep around the shoulders. We'll work on the deltoid, we'll come across the supraspinatus, work the rhomboids, and then we're really going to focus as we get up underneath with the teres muscles, the top part of the lat and the subscapularis. So here's what that's going to look like. It would take a little longer for the purpose of the video. I'm shortening it up. And from there, you then have the athlete lay on their side, and you take their arm, placing it up over their head this way to open up into where the teres starts to be stretched, and we work right along the top part of the lat. Set up from there. And the reason that's all important, as we're throwing, a lot of those muscles, you've got the teres minor helping to control or cause internal rotation, teres major working on external rotation, the deltoid muscles, they're all sort of working against each other. And so when there's restriction anywhere, it creates abnormal strains in those other places. So it's important to attack them all, but obviously spend extra time in the areas where you'll find that point tenderness. And frequently, again, the symptoms might be here when they throw, but when you get in there and you start pushing around, you're going to find a lot of those problems are up under the subscapularis, the top part of the lat and the teres muscle. So that's where we're really going to focus our time. And what we're going to do is we're going to work that until it's not sore anymore. Then we let them relax, come back the next day, we'll start it again. And as far as usage for the Theragun, it's done before your workouts, it's done before you're throwing, and more importantly, it's done after. When we've broken down muscle tissue and there's lactic acid from the workouts, that's when we're going to get the most benefit. So what I'm going to do is I'm going to share with you a listing of those benefits that happen with usage of the Theragun. The Theragun, it is a high-frequency percussive instrument causing what's referred to now as vibration therapy, which then increases blood flow within those muscles, increases pliability. For all you Tom Brady fans, we're actually going to be able to lengthen muscle by breaking up scar tissue and adhesions, making it more flexible and pliable. At the same time, we can reduce spasm when there's been an injury already, when there's tightness that's beyond just tightness, but has worked into a pattern of lactic acid causing more spasm and the spasm causing lactic acid. So it sort of resets the muscle and breaks those patterns, obviously decreasing muscle knots, which are just minor forms of spasm. And as we just mentioned with at the end of your workouts, it helps to clear the metabolites out of the muscle. So by increasing blood flow, gets rid of the waste product from all of your positive workout that you did. We don't want to leave that stuff in the muscle to become toxic. We want to get rid of it. So drinking plenty of water, doing the Theragun at the end of your workouts will help to speed your recovery, because your body then doesn't have to deal with all of that toxic junk that's left behind from your workout. So that's the little Theragun workout that we use for the shoulder. And if you have any questions, get in touch with us.